My QI project was on employee satisfaction. In the clinical setting, there were happy nurses and some nurses that it was hard to tell if they were pleased to be there. In the hospital, patients and clients can leave a recognition letter about the facility or someone that has taken care of them. The survey or recognition letters should be implemented for all the staff members as well. Happy employees can correlate with happy and satisfied patients. It will also help with the hospital's facility funding or investors with overall satisfaction. The goal of this research is to be done to increase the overall satisfaction of the employees and areas of concern to improve in the workplace. The target audience for this research is nurses and anyone involved in the medical field. Job satisfaction is a significant factor in the organization and enhancing productivity in employees. The goal is knowing how to get nurses involved and motivated for excellence in the clinical setting. When researching job satisfaction, it relates to Maslow's five-stage hierarchy of human needs. Looking at the last requirements of esteem and self-actualization comes into play for an employee. Esteem needs are respect, recognition, and feeling of accomplishment as for gratification in the workplace. Self-actualization is achieving one's full potential, including creative activities. In the medical field, it is always looking out for the client and their needs, as in putting out recognition letters or surveys to fill out about the facility. This should be implemented just as much and firmly for the employees in the medical field. Knowing how the nurses feel about the workplace, their coworkers, the facility, support from their job is very important to increase a positive workplace for not only the employees, but also the patients. When researching job satisfaction in the healthcare organization, it is related to many factors: optimal work arrangements, the possibility to participate actively in the decision making process, effective communication among staff and supervisors, and to be able to express freely one's opinion. On this note, to increase job satisfaction, it is allowing nurses to express their feelings or concerns and having effective communication. Employees have more motivation to work when there is open communication of bringing in interest, concerns, creativity, and planning. When the staff is looking out for everyone's well-being, it is more likely to gain improved performances. By reaching out and seeking the opinions of employees, it will improve the decision-making and problem-solving process. When I was on a cardiac ICU floor, nurses looked out for the well-being of all their staff and their patients, and they were able to report any concerns they had openly. This floor was very positive, and there was a board filled with satisfied patients. With this research and improving the need to implement more of knowing their employees' job satisfaction, it will increase the facility overall. The staff and the organization should respond by accepting this and understand how doing everything to improve the outcome of the healthcare performances. When doing my literature review, I found 4 different articles that related to my project. The first one was on stress-related burnouts in the profession was very high. The nurse satisfaction reflected on job stress and anxiety, relationship with colleagues, collaboration and good communication, job motivation, work demands, and professional development. In this article, it was to support the nurses by clinical nursing supervision that will have a positive influence on their perception of well-being. The clinical nursing supervision will have a positive effect on nurses' physical symptoms and feelings of anxiety, as well as having a sense of being in control of a situation. In another article, it supported my notion of happy nurses, healthier patients, and using programs to improve the quality of their employees' experience. Long shift work have a negative effect. Nursing staff size affect mortality rates. Job satisfaction equals better patient care, and better work environment Has fewer errors are some areas the article includes about improving employee satisfaction. Another article examines the experience of compassion fatigue, burnout, and compassion satisfaction among oncology nurses. The article talks about how healthy and supportive work environments are imperative to nurses' health, well being, and satisfaction. With improving these outcomes for the patients and the nurses, it will decrease the nurses' turnover and reduce errors. This can be implemented in nursing by using insertional changes such as creating policies and guidelines to develop interventions that support nurses. Another article um, was about how patient care requires the work of collaborating between RNs and PNs. If there is a lack of unity and unresolved tension among them, it can affect a patient's care. Nurse administration and managers play an essential role in addressing the interpersonal skills of nurses and providing the ongoing education on collaboration in their practice. With having a healthcare team with good collaboration, it will bring satisfied environment for the patients and especially the employees. The articles discussed in this literature search all about value ideas and articles on how to improve employee satisfaction. A big topic is communication and collaboration keep a satisfied environment. The goal is happy nurses, happy patients. This can be implemented by constant update in the system by providing policies and guidelines to keep the satisfaction throughout the healthcare field. The support of administration and management on checking on their employees, knowing how to positively influence their staff to work together and create an environment of nurses feeling more in control. With more satisfied employees will create a stronger and happy environment for everyone.